To see 4-year-old Noah Greenwood today is to witness a miraculous journey. From birth, Noah's story seemed like any other.
Very normal birth, normal baby in the beginning. Like, she was just completely delightful.
But soon, things took a worrying turn.
She was just crying all the time. At 8 weeks, we noticed that she wasn't really looking at us, that she was looking past us. And they kind of told us that sometimes baby's vision is just delayed and that it'll catch up and that it's not something to worry about. So we were relieved to hear that.
You eating your blueberries?
As months passed, Noah's milestones were further delayed. The diagnosis, failure to thrive.
She was born at the 89th percentile. By 6 months, she had dropped to the 26th percentile. I would frantically be Googling things at night, and then I would feel a little bit crazy for doing that. Like, why is she always making these fists?
After months of inconclusive doctor visits, the Greenwoods sought answers. An MRI at a pediatric neurologist's office in Boston provided devastating clarity. A Zoom call with their doctor. This, after all, was during COVID.
She just opens up the Zoom call and she just goes, "I'm so sorry." And like, my stomach just dropped.
Yeah.
And she was just like, you know, it's abnormal. This is incredibly abnormal. And she shows us a picture of the MRI and she's like, look at all this white. You can see all this white here on this MRI. This is abnormal. It's not how it's supposed to look.
The scan revealed Noah has Canavan disease.
First thing that comes up when you Google Canavan disease is that the life expectancy is 10.
A rare and fatal degenerative disease that causes progressive damage to nerve cells and loss of white matter in the brain.
Getting that diagnosis, when families would get that, the doctors would give them that awful phrase, take your kids home and love them for as long as they can, as long as you can make them comfortable. And for us, she said, there's a trial.
The clinical trial posted the very day Noah was diagnosed.
We were quite literally the first people to be told, like, here's something that you can...
Some hope.
Some hope.
Doctors at UMass Chan Medical School began working on Canavan disease in 1989. In 2017, they developed a gene therapy vector. In 2022, Noah became the third person in the world dosed with that therapy.
The first 3 months, we were like, are we just imagining this? Like, she seems to be getting stronger. Are we just imagining it? But by 6 months, it was very clear that it was a completely different kid. She was pushing up to sit on her own. Like, I mean, and she was sitting and she was starting to play with toys and making different sounds and doing all sorts of different things.
She could use her hands.
She could use her hands. They put her in a gait trainer, like this walker that straps her in, and they would move her feet for her. You know, we moved all the furniture out of the way so that she could just do it. She could just roll her way around here in her little gait trainer, bumping into everything.
To understand how far she has come, one needs to consider what would have been.
Without this, at this point in time, she would be on a feeding tube. She would not be sitting. She would not be...
Certainly wouldn't be doing somersaults.
She certainly would be doing somersaults.
Whoa! This is probably the first time I saw what I'd never seen before. I feel very emotional.
Every day the Greenwoods wake up, there is something new, something to celebrate.
This is a miracle. This is a miraculous, and I don't mean that in the religious sense, I mean that in the, this is miraculous.
I love you.
Wow, that's quite a story indeed.
Yeah, and you know, there's a lot going on, obviously, with the NIH and with the Trump administration. The family believes that that action actually threatens the progress that Noah has made. A lot of that progress, the gene therapy that was developed with NIH grants. And that is Chronicle for tonight. Thanks so much for joining us, everyone. I'm Anthony Everett.
And I'm Shannon Seymour. Have a great week, and we'll see you back here on Monday night. Good night, everyone.